Misdiagnosis is very common in the mental health industry, specifically the mental health industry, because a lot of diagnosis revolves around interpretation. Interpretation of symptoms, interpretation of results, and descriptions, and so on and so forth. Further, a lot of misdiagnosis comes from the fact that insurance companies push for a diagnosis right away. This is so that they will pay the clinicians. So oftentimes clinicians will diagnose people with generalized anxiety disorder or another anxiety disorder. And that's not right. We need to completely overhaul the insurance companies and the mental health industry so that misdiagnosis doesn't occur. Now, I've pulled up some information through Google AI, which has gone through all the research and incorporated the consensus here from the National Institute of Mental Health, the NCBI, Science Direct, National Institutes of Health, so on. According to one study, 71% of patients are misdiagnosed with generalized anxiety disorder. Let that sink in a little bit. 71%. 65.9% major depressive disorder, 92.7% bipolar disorder, 85.8% panic disorder, 97.8% social anxiety disorder. Now, the National Institute of Mental Health reports an estimated 5.7% of U.S. adults are diagnosed with generalized anxiety disorder, and 2.2% of U.S. adolescents are diagnosed with generalized anxiety disorder. So if we compare that population to the 71% misdiagnosed with generalized anxiety disorder, those numbers are huge. The percentages may not look big to the untrained eye, but that is a huge population of people who are misdiagnosed. Now, 19.1% of U.S. adults, around 40 million people, have been diagnosed with just any anxiety disorder, with 31.9% of U.S. adolescents diagnosed with an anxiety disorder. Around 40% of the U.S. autistic population has been diagnosed with an anxiety disorder, specifically generalized anxiety disorder, with that being 20.1% of U.S. autistic adults and 15% of U.S. autistic adolescents diagnosed with a generalized anxiety disorder. Now, according to research, there's about 2.21% of diagnosed autistics in the U.S. and 3.4% of children and adolescents diagnosed as autistic in the U.S. ADHD diagnosis is at 4.4% in adults and 11.3% in children and adolescents. So if we take a look, the current U.S. population is around 258.3 million. That's just adults. That is 77.9% of the population, with 73.1 million people, or 22.1% of the population, being under the age of 18, and 13% of the population, or 43 million people, being adolescents in the United States. Think about those numbers. Compare those to the numbers of people diagnosed with anxiety disorders, specifically generalized anxiety disorder, and then compare that to the percentage of people misdiagnosed with generalized anxiety disorder. You have a huge population of people there. And I think part of the problem is that there is no care in the industry anymore. It's just, let's put a diagnosis on this individual and go from there. Now, I have never been one to just jump to a conclusion right away. I always have to think about it and rethink about it. Consider all my options. And even in my diagnosis class, when we went through these case studies, I was always the outlier. Where everyone else, for example, with generalized anxiety disorder, when we got to that section of the DSM, when everybody was diagnosing with generalized anxiety disorder, I looked deeper into the symptomology. I generally came up with something completely different when it came to diagnosis. Something that better explained the symptoms that the individual is carrying around with them. We in the United States, our mental health industry, our medical industry, has a real problem with treating the symptoms and not actually treating the problem itself. So many disorders can be traced back to a generalized anxiety disorder misdiagnosis. Because it's right there. It's at the front of the DSM. It's one of the first disorders that clinicians come across when it comes to mental health. Everything is about anxiety nowadays to professionals. And that has a big part to do with insurance companies, but it also has to do with laziness as well. It's a huge problem and it needs fixed. While many clinicians may see the misdiagnosis of generalized anxiety disorder as not a big deal, it is. It's a really big deal. Coming from someone who is diagnosed 3 separate times, 10 years apart by 3 separate clinicians with generalized anxiety disorder, only to find out at the age of 41 he was autistic. What other diagnoses are we missing? What problems can we help people with if we get the diagnosis correct right away? There are so many people, children, adolescents, who don't receive the diagnoses they need that could give them the accommodations they deserve in schools, and adults in college or in work. So many accommodations they deserve, that they need in order to get through life, that could be given to them if they had the appropriate diagnosis right off the bat. We need to spend extra time as professionals. We need to spend extra time as a community in understanding our patients, our clients, our friends, our neighbors, our community. We need to do better when it comes to diagnosis and understanding of mental health.